My name is Zainab Shinkafi-Bagudu. I'm a doctor, a pediatrician. I'm the founder, CEO of Medicaid Cancer Foundation and Medicaid Diagnostics Center in Nigeria. I serve as a senior advisor to the Coordinating Minister of Health of Nigeria, advising him on women's health and cancer advocacy. I'm also a board member of the Union for International Cancer Control. Innovation is good, and innovation will bring progress. In my area of healthcare, which is cancer control, innovation will really help us to save more lives, which is the ultimate aim. However, if we look at my environment where I work, which is Nigeria, primarily a low middle income country, the greatest challenge that we have is awareness. And innovation can really help us to spread that message awareness. When we say innovation, many people think you are talking about high-end, expensive, cutting-edge technology. And yes, we need to do that. But for us in low middle-income countries, we have to start from the grassroots and take it to the treetop. So we start with the basics, low-hanging fruits of creating awareness, using basic tools, the telephone. Not everybody has a telephone. Sending health messages in languages that people understand. I'm an advocate and I create awareness. I create opportunities for communities to partner together and have more platforms through which they can improve their health outcomes. So I would like to see low-end innovation deployed to the community level. For that, we have to have partnerships both within country and outside country, globally, global partnerships between various institutions, particularly financial institutions. A lot of people don't like to talk about it, but finance is a huge issue. We can bring about research, we can bring about change only if we have the resources and the human power. For us to have the human power, we have to educate them, we have to train them. All of this demands funding and, of course, government synergy, working to streamline policies, understanding the needs of the people, and having implementation of policies. Most countries have excellent policies. They don't even need to make them. They're handed down from various development partners. But the problem comes with implementation. Sometimes the partners start a program and you're supposed to sustain and strengthen it in country. That is where the gap comes. So countries need to own programs. Partners that are bringing the innovative changes need to ensure that from the beginning there is local ownership by the institutions, such as the traditional institution, the religious institution, governmental institutions and agencies, and most of all, by the community. If the community doesn't understand what you're doing, then it's dead on arrival. Definitely, it's a good move. I'll be there, so it's a good move. It will work if we step it down to the various contexts of each country. So patients come from all over the world, and it might be one disease, but the way in which they've got the disease, the ways in which they respond, the facilities that exist for them to focus on that disease is very different. If we bring them together, share the experience, particularly those with lived experience of conditions, then we're likely to improve the outcomes, learn the good learning points, avoid the bad ones. What we are doing here, someone else has already done. There's nothing new that anybody is going to do. So we can learn from each other, we can form partnerships, we can network, and we can pull together finances and resources to increase our outcomes and make things better for patients.